Eval Health is an app platform for clinicians and researchers to create, share, and deploy clinical apps. To learn more, meet us at eval.health and click Learn. Hi, this is Jennifer Glenn, Chief Medical Officer with Eval Health. And we're going to cover converting clinical algorithms into apps. And I have a great example that I want to walk through with you today called Urinary Retention, Evaluation, and Catheterization algorithm. This algorithm addresses the need for practical guidance to manage urinary retention amongst adult inpatients. And this algorithm includes guidance on when to bladder scan, what bladder scanner volume should prompt catheterization, and when intermittent catheterization is preferred to indwelling catheterization. This algorithm was published in JAMA in 2024, so just over the summer, by Kristen Krauser, Karen Fowler, and Jace Mann. And they asked this clinical question: how should urinary retention be managed in the inpatient setting? And what they found using mixed method study, which is really expert panels, interviews of clinicians, they came up with some guidance around what are typical best practices or consensus amongst these experts and clinicians for screening and management of urinary retention among adult inpatients. There are no guidelines or widely accepted algorithms for screening and management of urinary retention. So you can go to one hospital, do it one way, go to another hospital and do it another way. And while that's not necessarily wrong, as there are going to be different populations and variations amongst practice, there's this idea that perhaps we could come up with some consensus on some high-level guidelines around this issue. And that includes balancing the complications of not treating urinary retention because there are risks to urinary catheterization. And so this boils down to translational research, which is the best low-lying fruit for building apps. And that's when experts find gaps in practice or inconsistency, and they go to the literature looking through guidelines and research studies and distilling down information into practical tips that can be used every day by clinicians and on a consistent basis. That means if clinicians are doing things rather consistently and uniformly across a practice, a hospital, or a region, they can begin to do some observational quality studies and find out if what they're doing is actually working or not. So the next step with an algorithm is then translating this into an app. And while it would seem to be straightforward, it's not always the case. And I'm going to highlight a few examples. So what I want to demonstrate to you first is a helpful skill, and I like using Lucid Chart, and there are lots of tools out there that can help you with workflow. And what I've done along with another colleague is map out what this logic workflow would look like in a decision tree. I want to share a few tips with you as you build your app workflow. First, I want to highlight the importance of keeping your logic simple. Not only is it going to make it easier for you to build and construct the app, but there'll be a lot less decision fatigue when the user is clicking through the app. And I'll show you what I mean. It can be as simple as doing your very best to keep questions to yes and no, especially in this situation. And let's look at one example. You could have started out in the app workflow with the first question being, does the patient have physical symptoms of urinary retention? And on the algorithm, there are 4 symptoms that the user needs to consider. The first question you could have built would have asked, do they have one of 4, or select which symptoms that the patient has. And that would then complicate the logic because you're giving them 4 choices, and likely in this situation a patient is going to have more than one. And while the app has capabilities to do multiple choice around selecting more than one option, it does complicate your logic matrix as you're building the app. So in this situation, it was quite easy to pose the question for this app workflow as, does the patient have one or more of the following physical symptoms of urinary retention? And then in the description of the question, we'll list the 4, and it'll be a yes or no. And so if the patient has those symptoms, then they'll go on to the left side of the algorithm. And in this situation, they're asked to go ahead and conduct the bladder scan. So this is a great example how the logic is kept simple and it's easy for the user to click either yes or no. Another tip I want to talk about is making sure that all the logic pathways have an endpoint, or that each question and answer has a purpose and it is explicit. And this avoids dead ends. And this is very important in app logic when a user is walked through one specific pathway. They don't have eyes on all the different options. I have a great example that highlights this. And if you look at the right side of the algorithm, the question is asked, do they have symptoms of urinary retention? And if the answer is no, then another criteria is asked. If it's been greater than 4 hours since the last void, or is there an order to check a post-void residual? And if the answer is yes, then they get a bladder scan. But as you can see in this algorithm, if the answer is no, there's no information on what the user is supposed to do. Now, maybe the logic would conclude that they probably don't need a bladder scan and you would stop. But it's important that in the workflow logic of the app that we've conducted in the Lucid chart, that we account for that logical pathway. So when the user is done in completing all of those questions, they're not just left with a dead end or a blank, but they have some instructions as to what to do. You want to make sure you put yourself in the shoes of the user and think like they think, and have a specific target audience in mind. For example, is this algorithm for nurses in the inpatient unit? Is it for surgical residents deciding what to do post-procedure? And having those user personas in mind as you build this will help you anticipate exactly how you want to ask questions, what kind of descriptions and added information that you want to provide. So that is my third tip, and that's the art of creating an app. And that is not only considering the user persona of who will be using this, but actually walking through each click in your mind as you're working through this app workflow and making sure that that user is getting their return on investment, or that ROI that we always hear about in the business world. And in this case, it's their time. So the time and the clicks and the decisions and the energy to get through this pathway, are they going to get out of it what they've spent in their time and energy? And as you walk through that and really put yourself in their shoes, think about those, think about the additional information, research, tips, cheat sheets, videos, anything that you think might help that user. And you can embed that throughout the app. As you build your questions, you can insert links to additional guidance, you can insert videos. One great example for this app might be if it's a difficult catheterization that requires additional tools of the trade, such as a coude catheter or sounds to help with urethral strictures. Perhaps you could put a video demonstrating how to work with difficult catheterizations. Again, keeping in mind your audience and not giving too much information and too little information, but giving the right information for the audience that you are targeting. And make sure that when you create apps, that you put in the app title and the description who the target patients and populations that this app will serve, as well as in the About section describing the type of setting that is most appropriate. And in this situation, this is an algorithm for the inpatient setting. And I'm going to run through the app with you and show you a little bit under the hood. You will notice the green diamond questions correspond to the questions that have been built. And in the first one, does the patient have any one of the following symptoms? Yes. And they have greater than 300 mLs in volume. And there's a prompt to request an order if needed, with the mindset that it's most likely nurses that will be using this. And then, is the patient high risk? And there are a few criteria listed. And then instructions to discuss with urology, and then what was the outcome with the urologist. Is the patient high risk? The answer being yes. And so the final recommendations state that this is a high-risk patient to catheterize with an intermittent technique with special considerations, and there's some education that's been added to assist. Again, you can download the decisions, and you can also type in some patient identifications, perhaps even a note associated with this set of decisions. And this is HIPAA and GDPR compliant. And then you can either copy the text and paste it into an electronic medical record, or it can be downloaded into a PDF. If you go to the Learn More section, this is an opportunity to, again, give the user information about this algorithm and the appropriate population and setting. And I've also pasted in here a link to the published algorithm, as well as the Lucid app workflow and logic map, so that the user can look at how these questions were set up and how the logic is working, as well as the original literature that supports the algorithm and the app. I can also go into the builder, and anyone can do this, even if you're not an author, so you can see how the app was built. Although if you are not the owner of the app, you won't be able to change anything, so this is perfectly safe. And as you can see, in the default section, there's only one section, and here are the list of questions, and here are all the potential results. And if you click on one of the results, you will notice the visibility rule of when this particular result is set up, and it is going to appear when this question has the answer of less than or equal to 300 mLs. And there was also a scenario test that was conducted to make sure that, yes, indeed, this result is valid and works as it was set up. Additionally, you can click on any one of these questions and also see how these are set up to appear. For example, the second question appears only when the first question is answered yes, and there's logic behind each and every one of those questions. I hope this video was helpful in giving you some ideas on how you can convert clinical algorithms into apps, as well as some tips to make sure that your app is effective and efficient and meets the needs of the population that you're reaching out to. If you'd like to learn more, check us out on YouTube. We have a great video series called Getting Started. Thank you for taking the time to explore eval.